Antimicrobial Resistance Talks, or in short, the AMR Talk, where we're bridging gaps and sharing solutions. This podcast is an initiative by the AMR Research and Work on Innovation and Sustainable Solutions Research, also known as the AMR WISE Research Group from University Malaya, Malaysia. Our aim is to increase awareness about antimicrobial resistance. As we're facing the rise of drug-resistant bacteria, ensuring equitable access to effective antibiotics is more important than ever. But with high costs and limited innovation in antibiotic development, how can we guarantee that these life-saving drugs are available to everyone while still combating resistance? In this episode, we'll discuss innovative economic strategies to make antibiotics more accessible and affordable while safeguarding their effectiveness. We'll also explore how these models can incentivize new antibiotic development without driving up resistance. Join us as we dive into the intersection of economics, healthcare, and global health policy and uncover how smart economic solutions can reshape the future of antibiotics and help with the fight against AMR. Our esteemed guest today is Dr. Kim Faure, the project leader of Secure, an organization set up by the WHO and GARDP to expand access to essential antibiotics to treat drug-resistant bacterial infections. Dr. Kim has more than 20 years experience and knowledge on AMR, quality improvement, and regulatory framework for patient safety systems. She has worked in South Africa's Ministry of Health and various countries in Africa to support the implementation of their AMR national action plans. Dr. Kim has a passion for redefining the way healthcare is delivered and is fulfilling this in her new role as the Secure Project Lead, seeking to ensure access to essential antibiotics for low and middle income countries. Good morning, Dr. Kim. Thank you for joining us today.
Good morning, Vedita. So happy that I can be part of this wonderful podcast.
We're excited to hear from you. So, to start off, could you tell us a little bit more about the organization Secure, which is improving access to antibiotics through the new economic models?
Yes, so Secure is an initiative which was started by the Global Antibiotic R&D Partnership, which is the NGO that I work for, and in conjunction with the World Health Organization. They came to the realization that one of the biggest challenges to AMR, especially in the low and middle income setting world, was the fact that a lot of countries don't even have access to the antibiotics that they need. And here we're talking about essential antibiotics that are used to treat the normal common infections as well as infections that are drug resistant. And the important thing is they realized is that we needed to make sure that low and middle income countries had a sustainable, equitable access to these antibiotics to enable them to be able to treat simple infections. And so the organization was started, and I've been involved for the last year and a half trying to develop the work, trying to understand what the interventions are that we're supposed to be implementing, and from there on trying to look at how we can start doing pilots.
That is a huge contribution towards the global silent pandemic that we're facing.
True.
So, what would you say are some of the most common barriers in accessing antibiotics, particularly in low and middle income countries?
Yeah, the most important thing is to obviously, before you start delving into interventions, trying to understand what the real causes are. So we've spent quite a lot of time trying to unpack those. And so the World Health Organization divides antibiotics into three different classes: access, watch, and reserve. Basically, it's your first line, second line, and last resort antibiotics. And they all have different access challenges. So access antibiotics are ones that are used very commonly, so they're very high volume products, but they generally, from a manufacturer's point of view, make them a very low profit margin. So what happens is we see frequent shortages occurring in across the globe, actually, with these antibiotics. In fact, last year, a few countries in Europe didn't have access to amoxicillin, which is one of the antibiotics in that class. And this was due to a huge demand. There was a flu season in Europe, a huge demand for antibiotics, and the manufacturers couldn't keep up the manufacturing process on their side. So there were bottlenecks and supply problems on their side, so there was shortages in Europe. One of the other reasons we find is that because the market for these first-line antibiotics there's very low profit margins, some of the manufacturers decide to exit the market. So they stop manufacturing, and therefore you start to have fewer and fewer manufacturers of that. So the volume of product that's being produced is low, and you start to get these kind of problems with shortages. Then on the other type of second line and third line antibiotics, or the last resort antibiotics, these generally are more expensive antibiotics. So one of the issues is affordability, because low and middle income countries will prioritize in their health budgets the procurement of the first line antibiotics because they generally are cheaper. They treat 80% of the common infections. So you don't really, you're doing the best good with your money with those antibiotics. So there's very much less budget available to look at the higher cost antibiotics. So what happens is that you'll have hospitals that get given a very small budget of money for those antibiotics, and when they run out of it in the middle of the month, they just don't have access to that product anymore. Part of the reason is also that a lot of low-income countries don't actually include the second line and the last resort antibiotics into their essential medicines list, which means it's not part of the procurement processes within the country. So what happens is you start to get other mechanisms of accessing of those products to the private sector, and then you don't have control of the way that those products are quality checked and registered in the country. And then you've got the antibiotics that are still on patent. So these are still with the patented manufacturer, very, very expensive products, but very low volumes are needed. So what happens is the manufacturers then don't register the product in all the countries where they can potentially be used because they don't see a market for the product in those countries. So then many of the low and middle income countries don't even have access because those products are not registered.
Trying to get antibiotics must be really difficult, especially for really bad infections where they need the last resort of antibiotics. And this can eventually lead to a lot of deaths.
So the reason that poor access causes resistance, exactly that, Vedika. So when you need an antibiotic that is treating a drug-resistant infection, you don't get it. So what then happens is that patient who's got that drug-resistant infection can then spread that infection to other patients. So you've got the whole thing around infection control, spreading infections across other patients. But also, if you don't have access to an antibiotic, what tends to happen is the healthcare professional will use the next available antibiotic. So instead of using the basic amoxicillin, which treats common infections, what they will do then is they'll use the next level or the next line of antibiotics, which might not even treat the organism that they're trying to what the patient has got, or it might be so broad that it kills that organism and a whole bunch of others. So what you're doing by virtue of that is you generating resistance. So, for example, in primary healthcare, when a patient's got a urinary tract infection, the basic treatment should be amoxicillin. But in some instances, what the healthcare workers are doing is providing ciprofloxacin, which is a quinolone. And now what we're seeing in low and middle income countries is widespread resistance to ciprofloxacin because of its overuse. So when there's a shortage of one drug, we use an alternative, and that then drives resistance.
Basically, it leads to a lot of misuse of antibiotics.
So inappropriate use, misuse of antibiotics, incorrect antibiotics being used for the treatment of an infection when it's the wrong kind of antibiotic to use.
That's quite a problem.
Yeah, big problem.
Yeah. So what strategies or economic models can we use to sort of overcome these challenges, and how can they improve the access to antibiotics and mitigate the spread of AMR?
So, in our work in understanding what the access challenges were, we then spent quite a lot of time trying to understand how do we address those challenges. And some of it was through the economic and financial tools. So, what we then did was we built a toolbox of these various tools and we tested the assumptions on how they would improve access to antibiotics, how they would improve affordability, how would they improve the availability of the products. So some of the things we looked at was stockpiles. So if you've got a global shortage of a product or a product that's going to be used very erratically in small volumes, if you have a regional stockpile, then that can help smooth out the demand. What it also means is that if the manufacturer goes out of, is unable to manufacture, you've got the stockpile that you can start drawing on until they have time to fix the problem. Because generally, those supply chain shortages are not long term kind of things. So, stockpiling is one of the things we looked at. Then the other thing we looked at is to improve affordability, especially for products where the volumes are quite low. Manufacturers are not going to be interested in just looking at, for example, providing the product to Malaysia at an affordable price because the product volume that's needed is very low. But if you put Malaysia, Thailand, Indonesia, Philippines, and a whole bunch of countries together, and they're all ordering that same product from the same manufacturer, so they pool their orders together and they give a big order to the manufacturer, then suddenly the manufacturer will be interested in providing the product and generally interested in providing the product at a discounted price. So by pooling orders and pooling the procurement process as well, you can improve the price of the product, affordability, and also then consistency of supply because you'll go into a long-term agreement with that manufacturer to make sure that they are committed to providing you with the product. So then there's not this much of an erratic supply. When it comes to the very, very expensive products, again, they are super low volume. So besides pooling the ordering and making it more attractive for the manufacturers, we've also looked at things like giving the manufacturers a guarantee, either a volume or a revenue. So in that instance, you'll say to the manufacturer, we guarantee that over the next 5 years, this group of countries will purchase 10,000 units from you. And even if you don't purchase the 10,000 units, the manufacturer will get the money for 10,000 units. So in a way, it means that the manufacturer knows that they are committed to manufacturing this amount of product. They know they've got a market and therefore they will continue manufacturing and again, give you a better price. The other thing we looked at is subsidies to countries. Now, this is where it becomes quite challenging because in the past with HIV and TB, the donor organizations have highly subsidized the products. In fact, most of the time given HIV and TB medicines for free to countries where they were needing it. One of the things that we wanted to look at was sustainability. So from the subsidies point of view, we identified that in order to get a product to the right price, we do need to do a short-term subsidy, which is more catalytic, which means that we give a subsidy in the beginning and we downscale the amount of subsidy over a very short time frame, like 5 years, in order for the product to get to that volume price breakpoint where it becomes affordable. And then the countries continue to pay for it. But in all our models, we've assumed that the countries are paying towards the products and none of the products are just donated. So that was the modeling that we did. So what we did was we tested the different types of economic and financial tools against the different antibiotic classes, and we identified which ones we think are going to be the most suitable. Now, the fun part is actually going and testing that out. So that's the next bit.
It's a really good initiative, Dr. Kim, I've got to say. Making it affordable for low and middle incomes, dealing with manufacturers, and creating such subsidies. I think it's a great step to making antibiotics more accessible for all. My question would be on regulatory next. So what regulatory changes are needed to sort of support the implementation of such an economic model?
So, a lot of countries need to look at accelerated registration of the products in their country. So, even with this mechanism whereby we are pooling orders and we're doing stockpiles, the product still needs to be registered in the country in which it's going to be used. A lot of countries like Malaysia have been looking at improving and accelerating the time to registration. And one of the biggest access hurdles is slow registration processes, specifically in African countries. So having a mechanism whereby you can accelerate registration is a good one. The other thing that's also being explored is with regional initiatives like the ASEAN regional harmonized registration process. So there, what happens is a whole bunch of countries get together. They agree on certain products that they want to register. They register it as a harmonized process where they split the work between the different countries. And then once it's registered in ASEAN, then there's a very, very, very quick registration for each of the countries internally. So that's another way that we can incentivize the manufacturers to get their products to a whole bunch of countries very quickly by having these harmonized regional mechanisms. The other things that countries do look at is special import licenses. I know Malaysia's also been doing a special import license for Astronam, but that's only a temporary measure. That is something to make sure that the product can come into the country really quickly, especially if there's a high need for drug-resistant treatment. But it must then have a time limit to it by which the manufacturer must then get the product fully registered in the country. So those are the kind of things that we need to look at in order for the mechanisms to work well.
Accelerated registration definitely is needed because this is not a problem we can, keep for another day. It's something
Exactly.
that we do need to act fast on.
Exactly.
And could you maybe talk a little bit more on Secure and Malaysia's collaboration?
Yes. So we've been talking to Malaysia for just under a year now, and we've been working directly with the regulatory authority who registers the medicines, with the pharmacy department, with some of the infectious diseases physicians like Dr. Suresh, who leads the AMR committee and work in the ministry. We've been speaking to the DG, and we've been trying to, first of all, understand which are the antibiotics that have the biggest access challenges in the country. And what are those access challenges? And what we've identified is there's a handful of products that are really important for us to do something about. We've also then looked at whether there's a mechanism that we as Secure are able to use to help address the shortages issue or the challenges with access for those products. And then what we've done is we've come sort of to a list of a few products. I think there's 3 products at the moment where we think we can do something about. The next step is to try and define how much of the product is needed, who are the manufacturers of those products, and how do we improve access. What do the manufacturers need to improve availability of the product, to register them in the country, and then what mechanisms can we use that are economic and financial to be able to address that. We've also been speaking with Malaysia. There's Malaysia's leadership in the region is quite significant at the moment, especially with the ASEAN chairmanship that they're taking on in the next year or so. And so we started looking at how do we include other countries in the region in the same solutions that we're building, because the minute you get more volumes together, more countries together, your buying power increases with the manufacturers, and then you can probably get a much better price and a much better solution. So that's where we are at the moment. We're very much enjoying working with the Malaysian government.
I'm sure they enjoy working with you too. And I hope this is a definite success in the future.
Me too. I wish, because I can get to come and visit Malaysia.
So, talking about success, are there any successful case studies or examples with similar economic models?
So there's been the economic models themselves in terms of volume guarantee stockpiling have been used in the TB world before. So in order to make available drugs for drug-resistant TB, XDR TB, Very many of these kind of volume guarantees and supplier subsidies have been used in the TB world. They haven't as such been used in the antibiotic world. There are some countries like Sweden which have looked at volume guarantees for the very high cost patented products. But those are high income countries that have got lots of money to be able to spend. When you start looking at the upper middle income and the low income countries, it's not so easy just to throw a large amount of money at antibiotic access like that. So we have to look at more innovative, creative solutions. And that's the bit that we're trying to develop from there.
And how do you think the success of this economic model will be monitored or evaluated in terms of its impact on antibiotic access or AMR?
So we are hoping that through implementation of these interventions in the model, we'll be able to increase availability and affordability of a group of antibiotics that we've prioritized. Ones that are particularly impacted by access challenges and ones that are really critical from a public health need to treat drug-resistant infections. We're also hoping that the interventions will help reduce the number and the duration of shortages that are occurring, because we're trying to stabilize the market to make it more efficient for the manufacturers as well as for the countries. And then that in itself, by having those antibiotics accessible, hopefully will reduce the AMR-related mortality in low and middle income countries, and specifically because of the large burden of AMR in children and newborns, we're hoping it will impact the most on the AMR-related deaths for newborns and children.
Great initiative. And so we're all playing a big role towards this, but what role do healthcare providers and communities also play in ensuring the success of this?
So I think the healthcare providers are at the forefront in two ways. One, they should really be making sure that they use the right antibiotic for the infection and the syndrome that they're trying to treat in the patient, and try not to use inappropriate antibiotics. If they have a challenge with an antibiotic not being available, they should let the ministry know that this is an important antibiotic and they need it. And then the second part that they have to play is they have to make patients aware of when they do and don't need antibiotics. Because a lot of the infections that are being treated are still viral and they don't actually require an antibiotic. When they require an antibiotic, the right one should be given. And patients need to start to understand that there's a difference between a virus and a bacteria, and the infection that you've got doesn't need or does need an antibiotic, and then to take the antibiotics appropriately.
Be more awareness. And what happens a lot of times is the patients themselves start to pressure the healthcare professionals to give them antibiotics. So healthcare professionals need to sort of stand their ground, and community awareness.
Exactly.
Like this
podcast. Exactly. Agree.
All right. So how do you envision the global landscape of antibiotic access or AMR management changing with the adoption of this model?
Well, what would be amazing is that Secure doesn't carry on being an entity, and that it becomes embedded within the country's way of doing things, that it becomes part of the way that countries work together in a region, that countries actually take up these processes and make it their own, and therefore we don't need to have any other kind of global donor funding to support these kind of processes going forward.
Thank you. And last but not least, what is one message you would like to give our audience today?
I think the most important thing we can all realize is that we have a greater role and responsibility than just treating ourselves when we take an antibiotic. When we take an antibiotic, we impact the entire community around us when it comes to the resistance and the preservation of those antibiotics. So we've got to think big picture here, and that this is a community and a national, international kind of concern, and ourselves, what we do daily with antibiotics impacts that entire community.
With that, thank you, Dr. Kim, for your time and your insights. It was very nice to hear a different perspective of antibiotic resistance. Usually we hear about prevention, but hearing the economic side of accessibility and trying to get antibiotics, I think that's a very refreshing take for a lot of us. So thank you for that. And thank you for the initiative. I hope much success to all of you.
Oh, thank you so much,
With that,
Vedika.
with that, I'm your host, Vedika Bhatt. This AMR Wise podcast series is brought to you by University Malaya Malaysia. This podcast series was created by Professor Sheila Punampalavanar, an ID physician in UMMC Malaysia, Associate Professor Dr. Cindy Tay, a microbiologist in University Malaya, and me myself, Vedika. To learn more, please visit our website mentioned below. The recording of this podcast was supported by the Department of Social and Preventative Medicine and the Visibility, Information and Communication Unit, University Malaya. Thank you for listening. Please join us and stay tuned for our next episode. This podcast was supported by a grant from the Foundation to Prevent Antibiotic Resistance. Bye bye.